recently, so we're gonna dive in and we're gonna talk a little bit there. It's a huge topic, endometriosis is, and there's a like a wide range of experiences in people that suffer with endometriosis as well. So we're gonna touch on some important aspects of combining a few different ways of caring for it, because it really is something that needs a multi-pronged approach from both conventional and alternative, or if you want to call it alternative, if you want to say Chinese medicine approaches. It needs a bit of everything, and it needs dietary and lifestyle to really manage it as best it can be managed. So excuse me. What would be some of the advice you give people, Amanda, regarding diet? What would be some of the advice that helps in endometriosis?
Well, one of the in Chinese medicine, the yang deficiency, which is the warming, transforming, and transporting qualities in the body, are often compromised, and which can lead to a number of the problems. So it's basically to boost those qualities will help reduce pain, and it'll also help just reduce the whole stagnation that and lack of movement that you can get with endometriosis, which results in a lot of the pain and a lot of the kind of the effect of the endometriomas binding onto the bowel and different organs. So eating foods that are warm, cooked, lightly cooked vegetables are really important. Raw foods, even though you might be told that they have an awful lot of vitamins and minerals which are lost in cooked foods, they certainly do. But the thing is that your body has to actually be able to absorb those to be able to make use of them. And so often raw foods aren't really bioavailable. So you're better off doing exactly what the Chinese do, which is they do a lot of stir frying, which they partially cook the food. Yeah. So they basically get the best of both worlds. And it's also just makes digestion an awful lot easier. And it's also warm. Warm foods and keeping warm are both very important things to ensure. Another thing is reducing coffee, which, apparently coffee is like where, I think we top some of the coffee polls in Europe for the number of coffee shops that we have in Ireland. Like every second shop seems to be a coffee shop.
It has taken off in a big way for sure.
Yeah, it's just so delicious.
It is delicious. It really is.
I'm a big coffee fan. But the thing is that really to absolutely cut it down, what it does is it's basically, it binds to it inhibits the one of the hormones, which is called sex hormone binding globulin hormone, and it also inhibits androgens, and they both actually help in this yang function because they have a moving quality to them. Okay. So coffee is also very, in Chinese medicine terms, it's quite stagnating. Okay. So anything that inhibits movement is not a good thing. The other thing about coffee is that it's diuretic. So you're there putting your body to all of this work to digest this food. And you are already a bit depleted with the warming and transforming qualities anyway. And on top of that, then you're drinking coffee and you're literally peeing out all the work that your body's been put to. So that is a major reason to cut down on coffee. And unfortunately, decaffeinated coffee doesn't make any difference. No. In Chinese medicine, it's all down to the flavor, and that bitter flavor is quite draining.
Okay.
It drains qi, and qi, lack of qi drains yang. So it's. I just give it up. The thing to do is to just basically, if you do drink it, celebrate it.
Yeah.
Have it with somebody you really like. You know, don't just go and have coffee with a boring person. Go and have hot water if the person's boring. Uh, um, you know, have it with somebody you really like in an environment you really like, because it really isn't brilliant for you.
Mm.
Like having alcohol. Alcohol isn't brilliant either, and it's the same thing. You know, you don't go and have, you don't go and, you know, kind of have a drink by a stand in the middle of the road. You know, so, you know, treat it with respect. That's really,
Yeah, that's a good point. And not to forget as well, we were talking about avoiding cold. Iced coffees are going to start becoming very popular very soon. It could become really popular every summer. So adding more cold in as well. And from the Chinese medicine perspective, it's not ideal. I think the individual as well, if they find that they get a huge improvement in symptoms, it's a motivator then to continue with it and find a nice alternative for the time, you know, for when they do opt out of coffee and then only having it occasionally as well.
yeah, absolutely. There are other things like, you know, sugar, gluten, and dairy. They all are, you know, they can elevate inflammation, and that they should also be really cut out. There's, you know, there's so many other alternatives, so you don't really need them. Is quite a big thing. And, you know, people always go on about, what about my calcium? Well, you know, the years ago, the Department of Health brought out a health pyramid, and in the dairy section, you were only advised to have 1 pint of milk products a day. If you have milk on your cereal and say, I don't know, 5 cups of tea with milk in it, that's in excess of your pint before you've even put butter on your toast. So, and out of that only a third of that will give you your daily, it'll only give you a third of your daily recommended calcium levels. And if you have a lot of phlegm or damp, you know, if you've sinus symptoms or anything like that, that also doesn't help with endometriosis. So if you've damp phlegm symptoms, if you're feeling a little bit muzzy headed at times, that often indicates that you've got a slight dairy intolerance. So be careful around that.
Now, from what I've seen, traditional Chinese herbs can be really key to helping with endometriosis as well. So would you use herbs to treat frequently, or would you combine acupuncture and herbs?
A lot of it depends on the level of endometriosis that people have. But by and large, the Chinese herbs are a must. You know, they're really the main thing for getting rid of, you know, for helping to control the symptoms of it. Because in a formula, you can have, you know, in excess of 15 plus herbs. And all of those herbs, they act together, but they also have slightly different qualities. So you'd have herbs that would move blood and break up the endometrial masses. And you also then have herbs that support the underlying constitution that has led to the masses developing. So you're treating the cause as well as the effect. And but definitely, if possible, the herbs are a must. The food is very, very important, because there's no point in you know, it's like putting petrol in a car and expecting it to run and you've got a hole in it. And it's, you know, the petrol is just going to run out. You're not going to make any distance. You know, the whole purpose of the journey is to get somewhere. And if you've a leaky tank, so the food, if the food isn't done and the lifestyle, that you have a leaky tank. And but what really does help as well at different times in the cycle to help with movement is the is acupuncture. Is very important as well, particularly in the latter half of the cycle from ovulation onwards, because you know, if you can help with good ovulation, you're laying a good hormonal balance. And then as the person approaches up to their period, they can become more stagnant and the masses start becoming an
Yeah.
issue, and there can be pain. So acupuncture is brilliant for that.
Mm. Yeah, I know it is brilliant. Acupuncture is brilliant for the pain, and considering these lesions, they're responsive to the hormonal cycle. It's a tough condition. It is tough for people with endometriosis. They're seeing this every month. It's the same. It's being built up, and it has nowhere to go because it can't leave the body. But yeah, so and then lifestyle as well is important as well, like managing stress and getting the right exercise and all of these things too.
Yeah, a lot of people find the pain is eased with exercise, which is important, especially exercise that involves, moving the hips and really walking out. You get some people who their exercise is largely, say, walking to and from work. Well, if you're walking in town, you're not really swinging your hips, you're not moving and getting the whole pelvic girdle to move, and that really helps to ease pain. And to do that right through the cycle, really good long walks is very, very effective, rather than short town walks where you're walking rather fast and your footsteps are quite short. And cycling isn't as wouldn't be as good as walking.
Okay, that's a really good point. Yeah, thank you for mentioning that. Some endometriosis sufferers, they get great benefit from visiting somebody who's a like specialist in pelvic health physiotherapy.
Yeah,
can be called for as well. I'm very conscious that we're listing off a lot of things. You need a good gynecologist, you need all these things. It really does mount up for people, but it depends on the severity. It depends on what's needed by the individual as well. But really, the more ways that we can help, the better, for sure. And what else is really key is having healthcare professionals that understand what the nature of the condition, understand the pain, take the pain seriously, because this is serious pain we're talking about. It's not like I have a normal cycle and I get a little bit of period pain every month. It's a very different classification. It's serious, and it can really interrupt your life and your quality of life as well, and all of these things.
Yeah, very often it goes, undiagnosed. It's just, not taken seriously. I think for a lot of people, I've been practicing for a long time, and what I notice is that, the patients, people who scream loudest. So, when you go to your GP is only going to, a lot of assessment is done on how insistent you are. People don't kind of quite realize this. So you really have to go and have a list with you and a list of questions, and don't just arrive in and say, I've got really painful periods. That isn't enough for a GP to go on, and the GP is the person who's going to be referring you to a gynecologist, and that is a very important thing. Another important thing is that, just doing a basal body temperature chart can actually really be quite a good indicator for it, because the blood pools so much in the body. You find that the transition of temperatures around ovulation, there should be a shift in temperature from pre-ovulation to post-ovulation, and sometimes that isn't very well marked. And also then between just before your period, the temperature should dip, and then you should get your period. And sometimes you can, often that temperature shift isn't very marked either, and that actually is quite a good indicator, as well as premenstrual spotting is a good indicator, because there's so many reasons why you might have painful periods that mightn't be endometriosis at all.
Of course, yeah.
As much observation as possible is makes a huge difference.
This is so true. This is so true because historically what was like recognized as the gold standard is it's not always possible to go all the way to doing the laparoscopy and taking a biopsy and checking the sample, because there are other ways as well, but they were always considered not as accurate. We can't know for sure. But there's just I'd only started reading it today. It's only just come out this month. There's some newer research that's doing a much more thorough review and evaluation and comparing all the different methods. And like you say, there's observational ways as well. So unfortunately I didn't get time to finish reading this review, and it has only just come out, so it might be subject to change, but it's encouraging to see that there's a little bit more thought going into it, and that we might have better diagnostics going forward depending on severity and presentation. So there's a lot to be hopeful about, and it's great to bring awareness. Like, of all the conditions to bring awareness, this one is so key, because there's a real lack. Sometimes people have never even heard of it, but they might start saying, "Oh, I have to take 3 days off work every month for my period." And you're saying, really, we need to really bring awareness up, and then even for people that know they have it, to let them know of all the ways that we can help, and the different things that can help depending on what's needed as well.
Yeah, because there's so many people who don't realize that actually your periods shouldn't be painful.
Of course, we're always the ones saying this.
Yeah, they should just be, there might be a level of discomfort, but discomfort is literally that, not pain.
Yeah, exactly. Differentiation.
Yeah, and you shouldn't be feeling exhausted after a period either. Periods should start, and another thing is they shouldn't be spotting before or afterwards.
No.
And a period should start and stop like it should be. And you shouldn't get massive amounts of bleeding either.
No, definitely not. There are several different causes of that, so that actually on its own has to be investigated as well. And that's something that the doctors should always pay attention to as well. And I mean, we see it a lot in clinic. I'm sure you've seen it as well. I see it from time to time. People will describe something heavier, but if it's their normal for a long time, it's their normal, and they almost don't realize sometimes that it's not quite as it should be as well, and that it's outside of the normal range. So but we always have to ask all those questions,
Yeah, and when you come across people and say their mothers and sisters might have had period problems, and for that family that is normal, but actually in comparison to the rest of the world, it's not normal.
Of course.
And there are very few conversations around periods, actually.
I know.
Women don't really compare. There's a really good book I recommend to anybody who comes to see me, and it's called the Period Repair Manual.
This one?
Yes, that one.
I just got it back from a patient the other day. It was out on loan, so it was on my desk. I had to check something in it. Yeah, I often refer to this one. It's
brilliant, because it's so clear.
It is, and it's it's perfect for the individual. It's great for us, but it's also great for the person with their period. They can go straight to whatever it is, and there's different possibilities. If it's a heavy period, it could be this, that, the other. And she's really pragmatic as well. She really explains really well, draws a distinction between the hormonal IUD or coil and taking the pill, because you can keep your ovulation in most cases if you use the coil. Now, the coil isn't for everybody, but it's a nice option to consider as well.
Yeah, absolutely. And of course then the pill and stopping the periods is the most common
for sure
Western medicine approach to endometriosis. And one of the things that people don't realize is that the pill elevates anxiety.
It can.
Yeah,
Mm.
And you know, it's quite a common side effect in it.
Mm.
And so once you're, you know, if you're aware of these things, you can take action. But if you're not aware of them,
Mm.
you're inclined to just carry on,
It's true. Yeah, absolutely.
you know, unaware. And so it's, yeah, it it definitely is worth seeking out alternative remedies for endometriosis.
Absolutely. Yeah.
You know, and then to just, you might always have to, you know, even when you become asymptomatic, you might need to, you know, for 2 weeks of every cycle, go and get acupuncture, or, you know, take herbs, and it just keeps the symptoms under control. But it's really worth trying to get to a level of quality of life that you can manage.
Yeah.
And, yeah.
Yeah. So the key here is that there are ways to treat it. That the key takeaway from this is that there are ways to treat it, and even though there's technically there's no cure for it, there's a way to keep it really well managed so that you can, if you wish, you can have children. And it's not impossible. Sometimes people are told it's impossible, or told that the treatment is to have children, which is a very big life choice to be told to make. If that's not on the agenda, or if you're a very young age, that's not ideal to be told that. But also to know that there is quality of life, and it doesn't have to stay the level it's at without treatment, and that there
Yeah.
can be a range of treatments, and it can be a matter of picking the combination and a bit of trial and error, finding the combination. Maybe it's the pill, maybe it's a combination of the pill with acupuncture and Chinese herbs and physical therapy, and getting the right exercise and eating well, of course, which is key. Like, it's foundational, like you mentioned, like you explained as well. So
Yeah, absolutely. Another thing that people don't, you know, on the lifestyle thing, is not overworking. Overworking is a huge mistake.
I know. In the society we're in now, it's almost like a badge of honor for some folks. You know,
Oh,
I
I know.
overwork so much. It's like, oh, you don't have to. I mean, we all love some of us love our work so much. I mean, I know I love my work, and some weeks I work a little bit more, but no, I like to try and keep a balance, because I'm preaching balance. But I don't know, it's probably the same for yourself to try and strike the balance to keep ourselves healthy and well. But yeah,
Yeah.
it'd be a tricky one for people to adjust that down. They feel like they have to do a certain amount, you know. So
Well, I think one of the things is that, you know, basically it's all down to quality of life. And if you're finding that you're, you know, you're going into work at 8 o'clock in the morning and you're still there at 7 at night, there's something wrong.
there's something out of balance.
And you know, if you're not able do do you know, your exercise, if you're not really seeing daylight either during the day because you're working,
Mm.
you know, you're working right through lunch, that isn't,
Mm. Yeah.
that actually isn't what should be. You know, your company shouldn't be expecting that of you, and in general they don't. And people just, you know, all of these reviews at the end of the year seem to terrify people. But you know, you're often better off being a tortoise rather than a hare, you know, being slow and steady and dependable, rather than being the fast erratic one. He gets, you know, he's kind of hitting all the targets, and then, you know, spends nearly a year out because they're ill.
This is it. Yeah, yeah. There's quite this burnout has become a very common phenomenon at
Yeah,
the
and
current.
stress just from not seeing enough daylight, and just not
Yeah.
actually. I think the new labour laws that are coming in about, you know, that you can't be contacted and you don't have to answer your phone, is that basically even at government level they're seeing that, you know, that people aren't having a good life working to the level that they're expecting.
They feel like they must always be on. If you feel like you have to be contactable at all hours, you're going to be always on. There won't be a switching off happening. It's not ideal at all. So
No.
hopefully it helps people. So
Yeah.
I think we've covered lots there. I think we got to cover everything we set out to. Was there anything else that you wanted to mention there before we finish up? Anything else?
No, not really. Not really. It's just the main thing is that, you know, is basically second opinions are really worth seeking. And you know, they're definitely worth seeking. And you know, it's about maintaining and controlling symptoms, and it's all about quality of life. At the end of the day, everything you do is all about the quality of your life.
Yeah.
And that's the most important thing. And if your condition is affecting your quality of life, you definitely need to do something about it. And you know, because it's all to be lived for out there.
Okay, very well said, Amanda. Thank you. I think I already said it a couple of times, but I'm going to say it one more time before we leave. Make sure you find your healthcare professionals that will take you seriously. If your doctor is not taking your pain seriously, then find someone else that will understand what you're going through, no matter what it is. All right.
Yeah.
Thank you so much, Amanda, for joining me this evening.
Great.
I hope
Thanks,
you enjoy the rest
Helen.
of the evening. Thank you. See you soon.
Great.
Bye.
Bye.